Welcome back to another episode of What's Next? Longevity Deal Talk. Lots of news today that you won't want to miss, especially when it comes to AI. First, this message.
Hello, I'm Stuart Hamilton, the founder and CEO of Amber. We empower caregivers to provide the best possible care by gathering information passively as your residents go about their daily and nightly routines. No cameras, no wearables, no buttons are needed. We use this data to provide caregivers with timely alerts and insights, enabling them to deliver the right interventions to the right residents at the right time. One of our newest clients has just reported a range of benefits, including a 53% reduction in falls in the first month. I'd like you to hear from them.
I didn't choose this career, it chose me. I took a summer job with my aunt in a small community, and a nurse there, she was like, "You have a knack for this." Our challenge in the community and any community right now is staffing. We need the right staff. Beforehand, it was just us doing our regular rounds, walking in on residents possibly on the floor. We get those alerts with those residents who are either exit seeking or have high fall risk. It gives an alert to the phones to give us an opportunity to get to them in time.
It was harder when you didn't have all the facts. If I know that you're getting up at night, if I know you don't sleep well, we can program our care plan around that information.
It's that invisible eye. It allows you to know that there's activity going on. Amber allows us to be able to pull that activity and identify the problem to where we can pinpoint that down, and we can look at the medications and make the proper adjustments to be able to offer the Amber system to them and explain to them how safe we can keep their family member has been such a huge plus.
It takes a resident seconds to fall. And so once we get that alert, we're immediately on it. And so we can almost get there just in the nick of time or right before. It's a great addition to any building, and we're glad to have it.
The Amber system has definitely changed the way I think about marketing. We can promise a lot of things, but to add examples and to be able to show data, it's perfect.
If you're in the business of providing care, we would love to help you. You can find out about us and learn more at amberhealth.com.
It is time for Deal Talk. I'm Fred Fishkin along with Mary Furlong. Hi, Mary.
Hi, Fred. We have an exciting lineup of guests for everyone once again. We're going to learn a lot about senior housing and AI, and of course, about deals.
And our first guest, speaking of deals, is Dan Herman, President and CEO and Head of Investment Banking at Ziegler Linkage Funds. He is a big deal and facilitates many others. Hi, Dan.
Good afternoon, Fred. How are you?
Great.
Dan, you have such a great perspective on the market. I know you've been traveling, and so we so appreciate your time with us on the podcast once again. Let's talk about some of the deals that you and your team at Ziegler have been involved in. I think maybe Covenant Living Communities is on top here, and take us inside what the trends you're seeing in the marketplace.
Sure. And I'm going to tie in our senior living and care marketplace as we do that. And we're also going to ask Grant Chamberlain, who heads up our digital healthcare investment banking effort, to add on that sector. So at Ziegler, we have 100 healthcare and senior living investment bankers covering senior living and healthcare providers, so bringing debt financing for their growth and M&A activities, and another 40 to 50 professionals that are serving the healthcare investment banking, sell side, and capital raising area, and heavily touching the longevity space. And we'll again have Grant speak to that. In the senior living and care space, we're back to where demographics are at all-time highs. Seniors above 75 will grow by 25% over the next 10 years. Phenomenal market opportunity for providers of senior living and care settings. and services, and we're back to where supply is at an all-time high across the not-for-profit and for-profit provider marketplaces, and occupancy is back to being at an all-time high from a total occupied unit perspective. The recent NIC data has shown that overall senior housing and care occupancy, or senior housing occupancy, is at 87.4, moving towards 90% by the end of 2026. So that presents a great backdrop for continued growth, continued capital flow, and continued use of services from all of the service providers, healthcare and IT service providers. With that in mind, we've brought a significant amount of capital this year, already over $800 million in senior living and care, with Covenant Living issuing over $100 million in tax-exempt debt, ACTS Communities issuing the same, over $100 million. We just priced Twin Lakes in North Carolina for $30 million of growth capital, as an example. Those are just 3 out of about 15 that have come to market this year. And where the capital is being deployed is heavily on expansion of existing locations where the brands have been established. Some new locations. We did a project for Forefront called Bay Vita. That was $250 million for a new campus in San Antonio. And then also for acquisition capital. So our providers are growing through affiliations with other not-for-profits and then acquisition of freestanding locations. That's on the not-for-profit side. For-profit side, occupancy is healthy. Growth has slowed dramatically, not because of the demand, but because the capital market constraints, in particular on the banking side, going back 2 years and 2 months to the Silicon Valley Bank and other related bank blowups, the market still is not flowing because the math doesn't work. So the Fed raised short-term rates at the same time. Banks lowered their loan-to-value levels, so the math doesn't work with current construction prices. And that's going to lead to occupancy continuing to improve for those that have existing locations. So that creates a great backdrop. Now, we've been on the conference circuit. You mentioned I've been on the road. We've interacted with dozens and dozens of providers around the healthcare services and technologies that they want to utilize. As you mentioned, AI is very popular, and the providers are out looking to put to work services that can increase efficiency on the back office side and on the enterprise side. And they're hearing and learning about real solutions that are out there. They're also looking at solutions around the clinical side, whether it ties into their EMR systems or might be fall prevention or remote patient monitoring. And then they're bringing solutions for engagement with residents. Those 3 core areas are driving all the interaction on the tech side. With that said, I'll turn it over to Grant to talk about the deal activity on the healthcare investment banking side.
Fantastic. Thank you, Dan. I'm Grant Chamberlain. I'm Senior Managing Director here at Ziegler. I lead the digital health practice that sort of covers across all of our subsectors, whether it's behavioral health, home-based acute services, senior health, and post-acute living. So I have a lens of how does services, technology, and hybrid models impact really 2 tenets of the place. How do we create tools and solutions that facilitate the seamless, unencumbered access into the systems across the spectrum, and how do we optimize workforce? And all of those things are being enabled by digital health. So interestingly, from a transactional standpoint, we've seen a really unique, from the set of initiatives post-pandemic. During 2020 and 21, valuations went way out of line, and we had money pouring into the space. A lot of it was poured in by CMS because of their access to and creating code sets for remote care management, and we had an enormous amount of money poured in, and valuations got way out of line. In 22 and 23, and early 24, it took a full 2 to 3 years of valuations getting back in line with what real market historic realities were. And in the last 18 months, we've seen an incredible uptick. And it's a healthy uptick because valuations are being done and transactions being done, and I think much more realistic parameters for where historic norms are, because the worst thing that can happen, why the chaos took place in the market, is when you overvalue an asset, you can destroy, really good companies. So we're seeing disciplined transactions getting done, and we're seeing a rapid separation of winners and losers in the space. So in a number of deals that sort of are relevant to this discussion, we represented a company called Strata, which was a transfer management into the system and on a post-discharge basis. And their solution, they were in several hundred health systems for identifying, creating post-discharge placement into the right level of care on a post-discharge basis. A lot of solutions, one of the most rapidly consolidating spaces is the chronic care management, the RPM space, the RTM space, the now buzzword bingo, where things are in remote care management. There's over 100 companies in that space that desperately need to consolidate, and we're finally starting to see that take place. There's 4 big players of scale that are creating the tool sets for seamlessly managing a continuum of care across the remote care management space. And a lot of that is in the senior living space as we're monitoring multiple comorbid patients. So I think there is, a lot of activity right now across all spectrums, a lot of it in the behavioral health. So the behavioral health space still is one of the most active spaces as we're navigating that. And behavioral health is becoming part of sort of more whole person care as we're navigating people through the entire continuum of their care journey and building in behavioral health alongside their chronic care management space. And I'll get into much more detail of some other areas, hot areas that we see as we go through the next set of the discussion.
So Grant, you have a new white paper out on AI in healthcare. Let's give everyone a taste of what's in here.
Now, this is our 5th version of this document. In each one of the papers, we sort of highlight where is money really moving in the space, where is momentum building. And in this publication, where we've talked about AI for years, this is the first time we're seeing AI really move the needle in terms of navigating what I think is a two-sided problem we have in this country. We have an enormous bolus of some of the most unhealthy patients in history coming at the system at one moment in time that have both unmanaged behavioral, unmanaged chronic care diseases, while at the same moment we have provider shortages like at no other point in time. We need to use AI, we need to use technologies, one, as much as possible to triage solutions. And triaging can be done using AI, but also being done to ensure that everybody in the workflow chain is operating at the top of their license. Because if you look at the actuarial tables, panel sizes of subspecialists is going to have to almost double in my mind to achieve and absorb the volume of care. So using digital health and technology solutions is going to be there. And that's where this paper for the first time, because we've always highlighted AI, hopefully will be influencing it. We spend the beginning 20 pages of the document listing the companies that are really moving the needle. And most of them are just pure and ministerial benefits. How do we remove all the ministerial noise out of the system so that we can, as best possible, return quality time to clinicians and providers and nurses? And so we're hopeful that this paper is one shows the evolution of where AI is coming into the space. And this also plays down to trust. We're finally at a place where these tools, technologies are really into the fabric of healthcare. I was down at the American Telemedicine Association conference earlier this week, and we've been talking about for years that telehealth is just health. It really is about the principle we talked about. Telehealth is just health. We really are talking about how do we create seamless, unencumbered access into the system and provide it, especially to the most vulnerable populations, rural populations, and senior populations that can gain access through these digital technologies. And then, as importantly, how do we bring forward access to the providers into those spaces is at the appropriate level of licensure so that we can manage through the shortage. We're expecting up to 100,000 physicians, and nurses and physician shortages in the next 5 years. In this version of the document, so historically we have had a placemats that included digital patient navigation, how biopsychosocial determinants of health impact the care models, a deep dive into Medicaid and why Medicaid solutions, why are these solutions fit into Medicaid populations, behavioral health, and as you've seen in the past, 4-page spreads on where smart aging solutions are embedded throughout the system. A lot of discussion about remote care management and what we describe as last mile solutions. How do we incorporate both pharmacy, lab, and imaging into the continuum of digital health? This paper, we introduced 6 new placemats. One is a broad ecosystem of who are the players in the AI space that are really leading the revolution of healthcare in that space. We present what we've visualized as the smart healthcare delivery system of the future, from both a digital front door through the smart room hospital infrastructure of today, and what is the post-discharge management and ongoing management. And we highlighted utilizing OSF, interestingly, as a care, as a placement for that, because they have a lot of infrastructure and leveraging a lot of community-based infrastructures and solutions. Honestly, probably one of the most advanced digital health and innovation labs and investment arms in the country. We've introduced sleep, and sleep to me is an area people haven't historically thought of as part of the fabric of digital health. But I'm convinced people are just starting to recognize, similar to behavioral health 10 years ago, that if you're not navigating, managing your sleep appropriately, and the 40% of the country has undiagnosed OSA, it is one of the real single elements of all your other comorbidities deteriorating. We also call out a big call out in women's health, and women's health on 2 ends of the spectrum. One in where and how we can get tools, technologies into labor and delivery. From a cost standpoint, 51% of the babies in this country are born into the Medicaid population, and if we can use digital health to get education, content, and awareness into that space, and as importantly and more relevant to this discussion, a big call out in terms of technology for menopause, perimenopause, menopause, and postmenopause solutions, and how we can use awareness technology and devices to help women through that journey is a really big call out in the paper. We've introduced, an area that has been in the space for a long time, digital therapeutics, and digital therapeutics is finally becoming, again, similarly part of the fabric that's care on an individual caregiver standpoint. But like sleep, we also introduced something that people sort of have asked me, why do you do it, is benefits administration. We have a big call out about the need for all of our benefits, both from a commercial and in the state and the federal basis, that all of these digital technologies have to be built into the fabric of the benefit design. Because if you want people to use and engage these things, if you want it to be consistently adopted, it has to be ultimately paid for and part of the benefit design. And so there's about 50 companies we identify that are sort of focused on bringing this, whether it's through third-party administrators or otherwise, into the workflow stream. So that's sort of a tease of the depth of this document, which is has now reached almost 70 pages.
Wow. Granted, just one quick question. There seems to be confusion out there. No surprise. There's confusion about a lot of things, about whether telehealth is going to continue to be covered by Medicare, and people just don't know because rumors fly. What's your understanding?
Well, it's probably, and again, I am part of the leadership committee at the ATA. It's one of the most singular things on a legislative basis, both at a federal and a state basis, that is a bipartisan element that is supported. And it's now part of the fabric of how certainly seniors think about getting care. And I really believe one of the best things that came out of the pandemic was that seniors learn how to use a smartphone, and more importantly, you learn how to use a QR code. They were forced because of getting their menu or getting their tests done, and that opened the aperture for digital health to be broadened. So it's going to be hard to put that genie back in the bottle, because getting care delivered across any level of acuity is, if people are become comfortable with it. But if you believe in the premise that we have a massive workforce problem, digital health and telehealth is a triaging element, so that everybody that is seeing a physician in person is at the highest level of acuity to be doing it. Everything else should be triaged using telehealth or using AI, and whether or not it's going to take time and effort, we don't have a choice. I'm a firm believer that as much as people think about digital health and telehealth or chronic care management, otherwise, we don't have a choice. The physician shortages are going to be so acute, and it's becoming part of the way seniors deliver it. And most importantly, things like cancer and oncology or clinical trials. If 70% of an oncology treatment or follow-ups can be done virtually, why make a vet get in a car and travel 300 miles to go to a clinical trial when 70% it can be done virtually? Why get somebody that's dealing with cancer get back in the car to deal with something that can be done virtually? Those are areas that, again, become part of the fabric of healthcare, but also it's just the right thing to do. It is the most compassionate way to deliver the care for those populations.
So do you want to give us some insight into how the white paper is intended to be used and the amount of research that went into it? We're one of your biggest evangelists, so it will be part of our program at the Longevity Venture Summit. We'll make sure everyone has a copy, but tell us what your thoughts are.
Yeah. And the breadth of what the use of it is really, the aperture is expanded. The last version, which we published 2 years ago, had 832 companies. When we finished the last one, I asked one of my analysts, where did we land on this new version? There's 1,576 companies that are listed in this document. And again, the document does not include medical devices and does not include life sciences, where there's almost equivalent. So this is just pure tech-enabled services, access solutions. 1,576 companies now, which was almost mind-boggling to me. The reason we put this document together, it started in the first iteration because the CEO of the AT at the time was talking about Teladoc and utilizing it for a Z-Pak or a UTI in the same breath as he was talking about it for delivery of advanced, ICU care or telestroke. I said, we're doing ourselves a disservice. If we want this document, if we want this sector to really advance, we have to make it easier for state legislative bodies, payers, board members at any of these institutions, post-acute senior living. What really is the value proposition? What is the right pathway for the commercialization, and how and should you get paid for it? So we built this on a sort of sequential by segment from a kindergarten level, if somebody wants to get all the way up to a PhD level, if you want to digest it in totality. And it really is focused on digestible placements for payers, providers, patients, state and federal legislators, nonprofit entities, so that when they hear about it, they can go to a subsection, identify, the areas and who are the companies that are leading it. And we try, by definition, to have 1,576. We try as best as possible to identify where they're going and start to identify who are some of the players that are starting to separate themselves, both in terms of scale and diversity of services, because we desperately need a handful of players of scale, anywhere from two to five players by the 13 subsegments, that allow us to really gain confidence in the institutions that, hey, these are players that have longevity, are going to be there, and can help solve us through this crisis that we're heading towards.
That's so exciting. And of course, I love the placemat format. It's so easy to understand. We want to put it in the hands of every investor there, the entrepreneurs, and all the stakeholders. So congratulations to you and the team. They just do first-rate work. And Dan, you also have a conference coming up this summer. It's an event I never miss. Can we look forward to your rooftop music again?
Absolutely. So we'll have the Ziegler Linkage Symposium on July 24th. And Ziegler Linkage Funds that you mentioned earlier has invested in 35 plus companies, and we'll have all of the ones that are active there. Many of them invest in the age-tech senior living and care market. And then we'll have a reception, and then we always like to have a little bit of fun with a local Chicago blues band on our deck.
So there's a theme of music in this podcast too, as we end hearing one of Lori Orlov's original composers. that she's playing inside senior living on the piano. So there's a great music vibe, coast to coast going on. And thank you for the amazing work, for taking time with us.
Thank you.
The website for more info is Ziglar.com. And while we are talking about AI, we have even more insights from our good friend, industry analyst, consultant, and thought leader at Aging and Health Technology Watch, Lori Orlov. Hi, Lori.
Hi there, Fred. How you doing?
Hi, Lori. It's always exciting to have you with us. I think we've been working together over 13 years, and you have some new research to share with everyone on AI and the impact on home care.
Yes, I do. I'm getting ready to put together the final document on this that I can ultimately publish. But I did publish a blog post about it yesterday, which is what you saw, and it talked about the possibilities for AI in home care. It gave it examples, 5 examples, and I probably have at least 3 or 4 more that I could tell you about. So an interesting situation is happening in the world of home care, which is that number one, home care is, if you just look at it from the outside, seems like an inefficient industry because there's one care recipient to one worker versus senior living, which has multiple care recipients to one worker. But the home care industry recognizes that there's an opportunity to use technology in much more extensive ways than they have done historically. And so some of the examples that have come up in the conversations I've had, they sort of fall into 2 categories. One is the technology changes that they're attempting, trying, evaluating, looking into, finding vendors for. And those include the manual recording of notes, which is going to be replaced by AI chatbots, AI-enabled tools, not so much chatbots as scribes. So the world of AI-based scribing is a growing industry for healthcare. Doctors increasingly have their notes initially scribed by a listening device in the exam room that they can then edit the notes later. That's the healthcare scribe. But scribing is entering the world of home care so that, in fact, notes, instead of having to be handwritten and then entered into another system, will be able to be recorded by a piece of scribe technology. And that's going to be a winner. Also coming in the near future are AI technologies that can listen to conversations and even in the future help with assessments of the prospective care recipient. So the care recipient is having a conversation with a possible caregiver or a franchise owner, and that information is being used to possibly transcribe into some form of assessment about what kind of care they will need. They use a process called record, transcribe, and even coach the workers about the care recipients, possibly even before they show up at the home. Then there's the world of remote monitoring and wellness check-ins, which has already been a big deal for some number of years now, the remote monitoring of older people in their homes when workers cannot be in the space where they are. But we're moving into a new era where acute and chronic conditions can be observed in the home, and suggestions can possibly be made about medications or checking a medication list against the needs of the care recipient. So that's another one. Wellness check-ins are increasingly popular. The idea that you would get a call from an AI chatbot, I guess I would say. You get a call from a chatbot, and the chatbot inquires in varying levels of detail about how you're doing. These can actually be friendly experiences, and at least one home care agency told me how they're working on making the chatbot, which actually has a name, a more personalized experience for the care recipient. So that is going to supplement in-person visits, because if you think about the fact that the person actually lives in their home 24 hours a day, but typically does not get 24 hours a day of home care, how can they be monitored and even in the future ask questions, excuse me, from devices possibly in their home, which they answer, and the answers can be used to determine whether a care manager needs to be contacted. We're moving in the direction of this idea for marketing and selling. They're called front door chatbots, which I thought was an interesting idea. Your initial contact with the home care agency in which you're inquiring can also be used as initial inquiries from potential workers about jobs with the home care agency. One person referred to that as a front door chatbot for the home care company, which I like that term. It's you can enter for either purpose. And also we know today that AI technology can follow a person around the home so that they're noted in their movements in the home, and in fact can be monitored for possible fall prevention. Historically in this industry, we've seen a lot of talk about fall prevention that is really fall detection. But we are now moving into a situation where observations about the person's gait, about the person's appearance, about lots of things about them can be detected in a way that could possibly avert a fall before it happens. And that's where we want to go, because the numbers of falls in the United States that are severe actually seems to be going up every year. Then there's some non-technical things that are pretty important to also note. I'm going to give you a few of those as well. First of all, in a couple of years, maybe sooner, we're not going to say the word AI. It's going to be gone. And the reason it's going to be gone is because when it's in every type of technology, it no longer is unique. And you can already see now with Word and search and lots of other tools that you may use every day from the internet, that they're already answering questions in a much more extensive way. And that extensive way is based on their AI understanding of the question. So we won't have to think about AI or talk about it anymore. It'll be standard business practice. The next thing you could possibly do in the future is improve the loyalty and retention of caregivers by identifying things that either the care recipient needs in conjunction with the caregiver, or ways to actually reward the caregiver for doing an excellent job. And most interesting to me is improving the training of a caregiver before they actually walk into the home, so that they're holding a device and they know that they're going to visit Mrs. Smith, and Mrs. Smith has the following chronic conditions. And in fact, she had a situation this past week where she fell down. So when the caregiver walks into the home, they're informed from software on their phone that is tapping into the machine learning AI capabilities of the system supporting that franchise. We'll also be able to see AI making suggestions about care changes. So having watched the gait of Mrs. Smith proceeding around the home, or watching other aspects about the home, it's possible that some suggestions need to be made. If Mrs. Smith seems to be periodically stumbling and tripping over her dog, or tripping over the rug, or other characteristics that can be detected, and you can make a suggestion. The AI technology can make a suggestion to where to focus the care and where to focus the worker when they come into the home. We're almost at a point, if not already at a point, where we can record the visual layout of a home and predict fall risk. There's some people who actually believe that within 5 years, you'll be able to predict 80% of people with fall risk prior to them actually falling. So those are some points. I think the gist of it all is how to give 24 hours of care without being in the home for 24 hours.
The fact that a caregiver can approach a care recipient more informed with more data.
Yes.
We can look for better care at home, and most people want to age in place at home if possible, correct?
They do. There's some news reports this past month about assisted living. That's a topic for another day. But reputation-wise, assisted living isn't doing great right now in the news media. Between the Guardian article about Sunrise and previous articles about Brookdale, it's no wonder people defer their move-in dates till their mid-80s. But that's more about reputation problems based on negative articles in the news, and not necessarily showing positive articles about what companies are doing to fix that. The other thing about home care that should be noted is when there's a shortage of worker in assisted living, home care agencies are often brought in to supplement the workforce. This is particularly an issue on Sundays. in a senior living, and if you've ever been in a senior living community on a Sunday, you might notice that there's multiple colored uniforms of the workers, and that's because they're coming from agencies to supplement the regular staff.
I think the growing humanity of having a better understanding. I mean, I watch the home care workers go into homes around here, and I look at the change in staff, and I think anything that can be done to have them more prepared, both on the disease conditions and also on the person that they're seeing, is important. And anything that will drive less turnover is also important. So
Right.
we're really looking forward to your report. We're happy you're going to be presenting this at the Longevity Venture Summit next month. For those in the industry who've been waiting on this technology, maybe not sure about the technology, what's the main message you have for people about AI in home care?
Well, I would say you want to do your due diligence. So you want to find out what the technology companies are doing. That's their due diligence step. Then you probably want to, as most agencies do, you want to pilot the technology in a limited way and see what it's doing. And then you want to potentially deploy it more broadly. And I think that's going on in the biggest and most famous home care agencies, all of which I've interviewed for this report. That's what they're doing. They see that there's a problem. The problem they have is recruiting and retention of workers in a time where the pay in other jobs is similar, okay? And the strain on the person is potentially less. Now, most people, as one interviewee told me, most people go into the home care space because they love older adults and they love what they're doing. It's not like comparing the job, as I tried to do with one of the interviewees, comparing it to Walmart, which pays approximately the same. It's not like that. It's that they want to work with older adults. They don't want to work at Walmart, and they want to have a good experience. On the other hand, it can be costly to work in home care for workers. One of the issues, my favorite story from years ago, is the San Francisco problem, in which the worker is 2 hours away, commuting into San Francisco to the home of providing private duty home care in someone's home. That's really not sustainable. And that's where you start to get into the idea of using technology to increase the loyalty and retention of caregivers. I haven't yet asked the question about sharing caregivers, which I did in a report a couple of years ago. I really think, for example, if you're going to a specific zip code location in a city, San Francisco being an example, you don't really want home care worker A and home care worker B from the same franchise providing the care if there's some way that they can pool some aspect of that, whether it's transportation or services. The other thing somebody told me about in one of these interviews, I think is pretty interesting. They are getting food delivered to the home, so that good food, not high quality food, delivered to the home, so that the worker doesn't have to prepare it. This is another way to improve the loyalty of workers in that particular situation, and burden them with less of that task.
It is great that the people who will be at the Longevity Ventures Summit, June 10th and 11th at the Claremont Hotel in Berkeley, are going to be hearing all about this. The agenda, the speakers, and attendees are really amazing. If you haven't already signed up to attend, this is for the audience, you really need to head to longevityventuresummit.com. It really is more crucial than ever.
Thank you again for the great work you've been doing for over a decade. And this is just one of your talents. Yeah, I have to say you're both a colleague and a wonderful friend. Another talent you have that I love is your music. Tell us about what we're going to be hearing as you wrap up the podcast, and tell us who you play for.
So we have a scheduled time to play at an assisted living facility around here. That's actually quite near here in the assisted living park that includes folks from the dementia care area. We're doing that. We're also playing in the lobby of the local hospital so that the nurses and staff can come down and get cookies and lemonade That's coming up around the time of July 4th. And for that, we'll be playing patriotic music. I've been playing with the same person now, Karen Mart, for 6 years. We met through the online tool Nextdoor, and it turns out our history and time playing the piano is approximately the same, although she's a very, very talented person who can be asked to play a piece that she hasn't worked on lately, and she can remember it by year and play for people taking special requests. I'm not capable of doing that. I learned to play the piano entirely through reading music, but we've been having a good time together. We practice typically once a week, and we play all around the area at assisted living facilities and the hospital. We played at Christmas, and now we're going to play on the 4th of July.
So tell us about the music that we're going to listen to as we wrap up the podcast.
This is kind of a cool thing for me, really. This is Fly Me to the Moon is the piece. But the cool thing for me is this is the first time I've actually improvised. I play the upper part and Karen plays the lower part. And this is the first time that I've actually improvised passages without, the music actually telling me exactly what notes to play. Part of the problem was that the notes were quite complicated in this particular version. And I said, well, I think it'd be just as well if I just, flew around the keys for a bit. So I do improvise in a couple of sections of it. And I'm very pleased with being able to have done that because I never did. And I started playing the piano when I was 8.
I think it's a wonderful piece. I know I'm going on Monday to hear Pat Stenson sing at the Center for Elder Independence in Concord. It's Pat's birthday that day. I'll say happy birthday.
Okay, there you go.
I love that you are both helping in the industry with this great research, and you're also there to enjoy and to entertain. And it's just so meaningful for people, as we know. Brad?
Thank you so much, Lori. We want to also thank everyone for tuning in, and thank you to our sponsor, AMBA, providing technology to enable responsive, personalized, and effective care. Discover how AMBA can benefit your facility, the residents, their families, and caregivers. Find more at ambahealth.com.